Hi there, are you Tina?
I am Tina.
Hi Tina, I'm Robin Business Practitioner. I'll be seeing you today.
It's great to meet you.
Thank you. What brings you in today?
Well, my husband and I, we've been thinking about, making babies.
Really? Wow,
Yeah.
that's exciting.
It's an exciting part of life for sure, but I just kind of wanted some information on tips to kind of improve my chances. I'm also kind of concerned about infertility.
Okay, well we can talk about that.
Okay.
Yeah. So, I think the first thing is, if I don't really know much about you yet, but if you're on a birth control pill, you want to be off of it for about 3 months before you start trying. That gives your cycles a chance to come back to a more normal pattern, I guess, would be, so that would be the first thing.
Okay.
And then are you taking any multivitamins or anything like that?
Here and there. I forget a lot.
Okay.
Yeah.
Well, by far, I think the biggest thing we can talk about is lifestyle measures that you can do that would increase your chance of getting pregnant. So we know that infertility happens in about 10 to 15% of couples. So it's a pretty,
Wow.
pretty big, yeah. And fertility, we have to try for about a year without meaning having frequent sex.
Oh.
For an entire year before we can say that you're having any fertility issues.
Okay.
Yeah. So.
Husband will like that.
Yes, he will like that.
Yeah.
Yeah.
Well, so it is pretty common
Yeah,
then.
10 to 15% of couples will experience that, so we can, hopefully decrease your chances of that happening.
Well, what's things I can do to increase my chance of getting pregnant then?
Yeah, so lifestyle by far is the most important.
Right.
And you haven't seen me before, but I talk about a lot of the similar kinds of things for everyone. But I would just be keeping your weight normal. Now you don't look like you have any weight issues, but on the other hand, we want to make sure you're not too thin. You have to have a 15 to 18% body fat for your periods to come.
Interesting.
So if you're too thin, you won't ovulate, and then if you don't ovulate, you can't get pregnant.
Okay, so as far as ovulation then, how can I tell if I'm ovulating? That's when I need to get pregnant, right? That's when it happens?
Yeah.
Okay.
Do you care if we come back to that in just a few minutes?
Sure.
Yeah. So I just want to go back to a few lifestyle things again. So I want to make sure that your weight is normal. So for anybody that's overweight, they would want to lose about 10% of their body fat to increase their chances. That will reduce their insulin level.
Okay.
Particularly there are a group of women that have polycystic ovarian disease. I don't think you have that going on, but if you know of anyone, weight loss is most important for that. So weight loss would be the first thing. We want to make sure that you get your stress level down. I don't know if you have a lot of stress in your life.
Yes, I do. I'll have to work on that.
Yeah, so cortisol we know can disrupt your menstrual cycle and throw your hormones off balance. You might want to watch, let's do some reading about that. Sometimes if you have too much stress, your adrenal glands will steal your progesterone level. And you have to have progesterone, for your cycle. So, yeah. So it's important to get stress reduction. Good sleep and along those same lines. So again, all that resting, repairing that you need to do, right? So that's good. That would be a good one. Let's see, what else? Oh, and your diet, yes. So one good thing you might want to try is getting rid of dairy out of your diet for like a period of 3 months or so.
No.
Yeah.
Why?
So they think that it thickens the mucus a little bit, and so that it causes inflammation, and I don't think that they completely understand why that happens. So it'd be worth a try to get it out. Minimizing grains. You don't necessarily have to get rid of all of them. Yeah. So I know I'm giving you lots of I know.
I love me some cheese. I don't know.
You love some cheese. Yeah. Well, it just depends. If you want to try for a year because you're young enough, and you don't get pregnant, and it's not a big issue, then certainly you can just try and not do these things. But if it gets to be more than a year, then we're going to have to incorporate more things, right?
All right, fair enough.
Want to make sure that you're getting enough fat in your diet. So
wait, but you don't want me to gain weight?
I don't want you to gain weight, no. But good fats are good for you.
Oh,
They'll make you feel full. They'll help stabilize your hormones for you. Lots of just non-processed foods.
Okay.
So. The next thing would be cutting back on alcohol if you drink it all. So we know that alcohol increases the risk of miscarriage. So once you get pregnant, we don't want to lose a pregnancy. That would be,
that'd be bad.
Smoking, both important for the male and the female, which we know. I think most people know that, but it can cut the sperm count down by quite a bit when people smoke. Yeah.
Okay.
Yeah. Let's see.
I should take notes.
Yeah, I can send you home. I've got a little handout for you that I can send you home with. Yeah.
Great.
Yeah, so that's probably about it on top of on in terms of lifestyle. But then you asked me about ovulation.
Yeah, how can I tell when I'm ovulating?
Yeah, so in order to get pregnant, we want to know when you're ovulating and the most optimal times to have sex, right? Because if we don't know the optimal times, then it's not
shooting in the dark,
right,
you know?
so to speak. So to speak. So you want to know when your most opportune time for getting pregnant. So if you have about a 28-day cycle.
Yeah,
okay.
Thereabouts.
So ovulation would be about day 14, kind of right smack in the middle.
Okay.
Okay. So your most opportune time would be about a 3-day window prior to ovulation.
Okay.
They even say up to 6 days, but the closer you get, so 3 days prior to the time.
So like day 11, 12, 13? Okay.
Yeah. And there's some ways that you can tell if you're ovulating. I don't know if you can tell if you are.
I mean, I guess I just recently, took up this interest, so no, I've never making a point
to notice.
To notice.
Well, some people notice that they have a pain in their side, like about where your ovary would be. You might notice that.
Okay.
The other way is to really pay attention to the cervical mucus, and even though this maybe sounds a little bit disgusting, I don't know, but it's still part of our, body. But you want to notice most of the time that cervical mucus is thick, and then right around the time you ovulate, it starts getting thinner and more watery.
Okay.
So as that happens, that's usually indicating that ovulation is getting ready to occur. So the more watery it is, then that's probably that's the go time.
Okay.
Yeah.
All right. Go.
And then go. Yeah.
Yep.
And then you can buy ovulation sticks to tell you if you're ovulating. So it's measuring something called luteinizing hormone, or LH.
Okay.
And you want to start a couple of days. So if you ovulate day 14, you might want to start looking at it maybe about day like 10. If you're not sure when you ovulate,
right,
maybe around day 10 or so to see if you're getting an increase.
Okay.
And once it increases, then it probably means you're getting ready to ovulate.
Okay, great.
And then the last tip as far as ovulation is monitoring your temperature.
I've heard of this.
Yeah, but it's kind of, it's a lot of work. You have to get the old-fashioned thermometers. They're a little hard to read with mercury in it. You have to check your temperature before you get out of bed in the morning.
Sure.
And you have to log it pretty much every day of the month. So that's a big commitment.
So does your temperature drop or increase?
No, it goes up just about a half of a degree at ovulation. Now, at that point, it's probably too late.
So you want to do the 3 days before.
Yeah. So you want to watch. But this becomes important if you don't know when you're ovulating, to kind of get a pattern going.
Yeah.
So once you see that spike, it's probably too late at that point. So it would be helpful for the next month.
Okay, gotcha. Well, so are there any like supplements that I can use that would help me?
Yeah, so at this point I probably wouldn't put you on any kind of, if your periods are pretty regular, I wouldn't put you on any.
What is that?
Oh, it's just a train outside my office. Is that going to bother you? You think
no, I think we can keep going.
Okay,
yeah.
Okay. So I probably wouldn't put you on anything at this moment, but if your periods become irregular, we might want to check your hormone levels and put you maybe on some progesterone to help lengthen them. Let's say if your periods are short, like in between, they're less than 28 days, we could use progesterone. There's something called Vitex, which helps work on the pituitary to help your ovaries ovulate more regularly.
Okay.
But there are some other like vitamins you could do. Vitamin D, we'd want to check your level and see where that level was at. Vitamin C, both important for the male and the female. That helps the sperm whip around a little bit better.
Oh, good. Yep.
Zinc and folic acid is very important, but a methylated form of folic acid. And we can talk about that more later.
Okay.
But we can get you a multivitamin that's got a methylated form in it. But that would be very helpful just for starters.
Fantastic.
Yeah.
Well, okay, so speaking of the male side of things, like what else can they do to increase our odds?
Yeah, so the smoking and the drinking goes for them as well, right?
Right.
But they shouldn't be wearing tight underwear. Boxers are a little better for them. Let the boys hang out.
Really?
We don't want things to get too warm.
Yeah, let them breathe.
Let them breathe. So bicycle riding, or tight underwear, sitting for long periods of time, computer on their lap. Those would be the main things.
Okay.
Yeah.
So keep the heat off.
Keep the heat off. And then it's a good idea, especially after a year, if you haven't gotten pregnant, to have him get his sperm count checked, because up to 30% of infertility can be related to males, and it's not the female at all. So we want to make sure we get the right side of the coin fixed here.
Absolutely.
Yeah.
So do you order that test? Or?
Yeah, we can order that for you.
Okay. If we need it.
Yeah.
After a year.
Yeah. And then also after a year, there would be more, we probably would send you on to an OBGYN at that point and get some more extensive testing done that I wouldn't do here in the office.
Well, knock on wood, we don't need that.
Right, no,
So-
we'll be hopeful that you'll be coming back with some good news in a few months.
Yeah, a little bundle of joy.
And that's right. Well, good luck to you.
Thanks. Yeah, that's all I have. So
Okay,
I'll,
all right.
I'll keep you updated.
All right, thank you very much.
Thank you. Well, that's our little skit on fertility and ways to increase your chances of becoming pregnant if that's what you're trying to do. Do you have anything else to add?
No, we'll add some more videos later. We're probably going to do one on PCOS, which is a big problem right now, and people getting trouble getting pregnant. So we'll do that one a little bit later. But these tips would hold for those gals that have that issue as well.
Yeah, absolutely. We see the PCOS a lot now. So, as always, subscribe to our YouTube channel, give us a call, like our Facebook page, and we will see you next week.
That's it for the Hormone Helpers. Have a
Bye
good day.
from your
Bye.
Hormone Helpers.